Welcome everyone to today's SWAIH talk. So Ashley is going to be talking to us today. So Ashley is Professor of Population Data Science Research at Population Data Science at Swansea University, and he's been there since 2008. He plays a substantive role in major research programs and projects utilising population scale data, and that's mainly using the SAIL Databank, which he's going to talk to us today about. And I guess it's my fault in a way that Ashley's here today. I went to a conference up in Manchester, which was a Cancer Research UK conference, looking at how we can use all kinds of data to help diagnose people with cancer sooner and detect cancer sooner. And there were various people from around the UK talking about various data sources. And someone stood up and was giving their talk and I think summarising different data sets across the UK. And they said, oh, there's SAIL in Wales, and that's a bit like HES, but for Wales. And that certainly was not the case. And I knew certainly a bit about SAIL from previous experience. And then Ashley stood up later on in the day and gave a talk about SAIL, and I think really blew the audience away with what was going on in Wales. And I think SAIL has really set the benchmark for what people can do with secure data environments and big population level data sets. So on the basis of that, Chrissy was asking if anyone had any suggestions for speakers, and Ashley was top of my list. So with that as an introduction, I'll pass over to Ashley, and over to you.
Brilliant, thanks Gary. I'll just see if I can share my slides, hopefully that works. Brilliant. Okay, so afternoon everybody, and thanks to Chrissy and Gary for the invite to speak today. So yeah, got a bit of a wide remit for today's talk, so I'm going to try and cover as much as possible and do a little bit of a whistle-stop tour around TREs, SAIL in particular, and then give you some examples from some of the recent work that I've been involved in through the COVID-19 pandemic around how we use SAIL as a trusted research environment. But if you have any further questions, as Gary said, feel free to pop them in the chat or save them till later, and I'm happy to answer any questions. So I guess just as a start, and apologies, quite a few of you might already know this, but I think it's useful to set the scene. So what is a TRE, or a trusted research environment, and what are increasingly also being called secure data environments these days? So essentially a trusted research environment, or an SDE, is a single secure environment where organizations make available through secure mechanisms a copy of different data, which is usually at an individual or area level or aggregate level, depending on the sensitivity, which can be accessed by approved users to do their research or produce their intelligence. There's a wide variety of existing TREs and SDEs across the UK and across the world, and driven by the Goldacre report, the Goldacre review and the report, which most of you will probably be aware of, and the 5 SAFEs. There's an increasing movement now in this direction around some of the existing TREs and potentially some new TREs and SDEs being set up for slightly different purposes across the UK and worldwide. So as Gary mentioned, I'm based at Swansea University, and we've got a variety of different research projects, programs and portfolios ongoing at any point in time, and these are just a handful of the ones that I have either direct or indirect involvement in. But the key thing about this slide I just want to draw your attention to really is the green circle at the bottom. So all of these different activities are all enabled and empowered by the SAIL Databank, and underneath that something that's called SERP, or the Secure E-Research Platform. So what is SAIL? So SAIL, as we mentioned earlier, is a trusted research environment, and it was set up to provide a privacy protecting environment where anonymized individual level data could be made available to researchers to deliver what they wanted and needed to do in order to produce public benefit, improve services and people's lives through an internationally recognized best practice system, which SAIL has been going since around 2007. And is currently sort of one of the world leading TREs when it comes to this kind of setup and the way that the data and the other access controls and things, which I'll go into in more detail soon. SAIL, and this slide changes all the time, so I've kind of given up trying to keep it up to date these days, but at any point in time has sort of over 20 billion records in it for over 5 million people longitudinally going back over 20 years. There's over 600 projects with sort of 500 active users using the environment at any one time. The key points, as I just mentioned earlier, are that no data ever leaves the environment. People access, or users access, the environment through the trusted research environment, and only results which are approved out through an approved dual disclosure control review process are allowed to leave the environment. And SAIL really pushes the boundaries then over the last few years and onwards to make sure it's compliant with not only UK data protection regulations, ICO, but also has things like ISO 27001, Digital Economy Act accreditation. So as SAIL has expanded out to have data not only on the population of Wales, but across the UK, and not only on health, but has expanded out to administrative data sources, social, environmental, lots of other Ministry of Justice, Department of Work and Pensions, these types of different data sources. It's really important that the trusted research environment itself, so the SAIL Databank, has all the possible available different accreditations so that you as researchers, or we as researchers, can then go and have those conversations with our data owners and our data partners to ensure that we can have those conversations and they are willing to share their data for, public benefit. At a very high level, I'm not going to go into this in too much detail because I've provided a link to the website on the slides and they'll be shared afterwards. But if you come to the SAIL Databank website, there's a lot of information on how things work, how you would apply to become a SAIL project. And just to get a very high level, the way the application process works is you go through what's called a two-stage application process. And as part of that process, you go through what's called scoping, which is a discussion with a senior user that's based in SAIL or at the user's SAIL to understand what your project needs, what type of data, what type of services you require. And through that discussion, then you really come out with what's called the scoping document that clarifies the scope and the ambitions of your project. And if there's any potential costs and or data acquisition or different services that are required. Most projects would then either go away and apply for a grant or some kind of funding, or if they're core funded or they already have access to resources, they would do that. And then you would come back and you would apply through what we call our Information Governance Review Panel, our IGRP, which if you filled in an R&D application before, it's very similar to a sort of standard R&D application. Once you get approval from the IGRP, and just to say the IGRP are an independent group, so while SAIL administer the process, all decisions on who uses and accesses SAIL data is made by that independent group, and they're made up of members of the public, Caldecott guardians, GPs, secondary care, healthcare professionals. So they make all decisions, and a random panel is convened for every application, and they make a decision on whether your project would be approved or not. And then in order to access SAIL, you become a user, and that involves completing a safe researcher training course and providing a copy of your CV, and then you'd be approved and you'd go through the normal processes to access the environment once you have your approvals. So how does data come into SAIL is usually a really important question I get asked. So all data comes into SAIL through the same mechanism. So if you take this really simple example, you'd have a file in the real world on the left-hand side, which would contain identifiers and your clinical or your domain information. This gets split into two different files, what we call the split file approach. So the file one, which contains the demographic and the identifiable information, that goes off to our trusted third party, which is Digital Health and Care Wales. They then link that to their population spine, which is made up of all individuals that interact with NHS Wales services. And they assign what they call an ALF, an anonymized linkage field. And then together with the file 2, which didn't contain any identifiers, it just has the clinical or the domain or the payload information, as we call it. That then gets loaded back into SAIL, joined back together securely, and then has further layers of encryption added onto it. And as you can see at the bottom there, what you end up with is all the identifiers are stripped. So this is a de-identified or an anonymized data source now with the payload information. And the value of bringing everything into SAIL through the same process is that with appropriate approvals, all the data sources that are in SAIL can be linked to all the other data sources in SAIL. And just to repeat, with obvious approvals that are available from these respective data owners in the IGRP. But what this allows you to do then in this really, really simple example is, if you have an individual who longitudinally might move house or change GP or go to different hospitals, each of those systems might have their own individual system IDs or identifiers, and you wouldn't know then that that was the same person. You'd see them all within a system or within a set of data as a different person or a different anonymized linkage field. The value of bringing everything to SAIL through the same process is at the bottom. As you can see, this is now geographically contiguous. So that anonymized individual can be linked longitudinally across all those data sources, which is really the power and the strength of population scale linked data. And to give a really simple example, once again, of patient journey analyses, you might have A&E or emergency department data, you might have some hospital admissions data, you might have outpatient consultations, and then you have a variety of medication or prescribing and consultations in primary care. You obviously have access to the whole longitudinal historic record, but you might then propose an intervention, or something might happen that you then want to evaluate. So because you have access to all the data, you can obviously go back historically and look at everything related to the individuals of interest in your cohort or your population. But because data flows into SAIL routinely, you can then continue to follow up those individuals anonymously as data becomes available to look at, did the intervention or did the change have the impact you were expecting? And the other advantage is because then as new data becomes available, and in this example, a few years ago now, we acquired all pathology data across Wales. So if you had an existing project and you thought, oh, actually, pathology data would be really useful to me, you can then apply for access to that and have it added into your project. And you can both historically and moving forward look at all pathology data related to your research question as well. So it really shows the power there of that longitudinal linkage. As well as individual level linkage, what we also have in SAIL is residential anonymized linkage, and it goes through a similar process to individual level in terms of split file. But what this allows us to do in SAIL then is look at residential anonymized linkage, so at a household level effectively. So where are you living over time as you move around through your migration, but also who's living with different anonymized individuals over time. Some examples of this then might be like household level analyses or socio-environmental determinants of health, but also looking at things like, do people live in care homes or do they live in private accommodation? What areas around Wales or the UK are people living in terms of, say, socioeconomic deprivation and those type of aspects? So really adds that extra layer. And this is something now that's becoming more common across the whole UK and has been available in Wales and in SAIL since 2009. I can't put everything that's available in SAIL on one slide, so I've just here tried to do a little bit of a snapshot. And as Gary mentioned earlier, when we met with Gary last, it was talking about cancer. So these data sources are a little bit related to the cancer work that we've been doing recently, and just shows you really a very high level overview of the different types of data that are available in SAIL. So, you have a range here of administrative, ONS or Office for National Statistics censuses. So we have the 2011 and the 2021 census linked in SAIL. We've got mortality, pathology, different cancer registries and screening and services, critical care, secondary care, as well as, which I'll come to in a little bit, about COVID, but a variety of different COVID related data sources that we acquired during the pandemic. And if you are interested in finding out a little bit more about all the data that's in SAIL, if you come to the website, as I mentioned earlier, all of the data that's available in SAIL is on currently 2 different UK resources. So you've got the HDR Innovation Gateway, the Health Data Research Innovation Gateway, and you have the ADR UK data catalog. So if you are interested, you can come to the website and then, or just go directly to those independent websites, and it's all open source. Everybody can access it, and it has metadata on all the different data sources that are available in SAIL. A couple of other additional ones that you can find on the website, which might be useful to you, are data insights. So this is where users under the Administrative Data Research Wales and UK initiatives have used some of the data for specific research questions, but have shared their knowledge then around how you can use linked data. So one of the ones on this list at the top was produced by my team. So where we looked into long COVID as a good example, we not only share how we've done that, but we've provided a reproducible methodology for how you might identify long COVID and the cohort of interest, those types of things. So if you're interested, come and have a look at these because they're really interesting. And then data explains are a little bit of a level below that. They're just on a specific data source and how you might want to use it and some interesting characteristics. So the second one on this list around the Wales Results Reporting Service my team was involved in. And this just tries to help users understand the complexity and the scale because there's billions of rows of data in the WRS, as you can imagine, 20 years of pathology, tests and results. So a really massive, powerful resource, but you need to understand how you might use data at that scale. So there's some help there in terms of these different resources. Obviously, everything we do has governance and privacy at heart, otherwise we wouldn't be able to do it. So as I mentioned earlier about the IGRP, all projects must be approved. All analyses must be completed within the trusted research environment, no exceptions. And results cannot, only results can be removed from the SAIL environment or published. So if you've done disclosure control in other environments, we're talking about things like less than 5 or 10 individuals, no data on small groups, those types of aspects. And all of this, once again, is based around the 5 SAFEs principles. And really just to emphasize here that stakeholder and public engagement is vital, not only to the work of SAIL, but to all of the projects that use SAIL. So if you are interested, SAIL has a long-standing consumer panel, so made up of members of the public who are there essentially to provide you input on all aspects of your project, from initiation to study design to thinking about your initial use of the data and the results, all the way through to publication and onward impact. So this group meets bi-monthly, I believe, and you can get in touch with the coordinator to arrange to present to them and just to ask them questions. They're a really open, amazing group of individuals who provide their time to this. So if you are interested, then please do reach out. I mentioned about SERP earlier, so I won't go into this in too much detail today, but I think it's important just to share with you all what SERP is. So the SAIL Databank was established for a long time, and then about 8 to 10 years ago, I believe it was, what the technical group at Swansea did was essentially split off SAIL from its infrastructure and formed what's called the Secure e-research platform. Okay, so as the slides kind of say, it's a customizable solution for data sharing, linkage, and analyses in a controlled and secure environment. And the way to think about this is that SAIL, all of the technology or the infrastructure, all the data management, all of those aspects are now provided to SAIL by SERP. SAIL still has its own governance group and it has its own management group and makes its own decisions from a what SERP call a tenancy point of view, but all of that technology, all of those developments are powered by SERP. And just to give you an idea really of the scale of SERP, so SAIL is one of 30 tenancies roughly at the moment, and some others you might have heard of are Dementia Platforms UK, UK LLC, which is the longitudinal linkage collaboration, the Adolescent Mental Health Data Platform, and there's also SERPs outside of the UK, so there's tenancies in Australia and Canada. So if you're interested in those types of services and those types of discussion around those aspects, then I really do encourage you to get in touch with the SERP team. So I've talked a little bit about SAIL and SERP and the technology and the processes. I'm just going to give you some examples now really around how we utilized SAIL during the COVID-19 pandemic, just to give you some ideas really around how we then use the power of this technology and platform towards those aspects. So when the pandemic started, we formed something called the One Wales Collaboration, which was essentially a multidisciplinary multi-organisation group across academia, public health, members of the public, government, NHS, and lots of other organisations, essentially to come together to respond to the pandemic as best as possible. And really not to under or oversell it, it was a gigantic team effort with a large number of individuals, which enabled us to do these types of activities. Some of the initial groups that were involved in the One Wales collaboration can be seen here. I won't go through them one by one. As I said, I'll share the slides afterwards, but it's just to say other groups and other organisations also joined over time into the One Wales collaboration. And if you are interested on some of the things, particularly around the One Wales collaboration, then I've put a link here to the website, where over the pandemic we shared a variety of different blogs and outputs and other aspects related to our response, and we continue to put things on there moving forward as well. So I spoke a little bit about how long SAIL has been around. I guess there was some really key developments that came about due to the pandemic that SAIL had to respond to as a result of the pandemic. So while SAIL has had routinely collected data flowing into SAIL for many years, it was usually around sort of a monthly or a quarterly or a 6-monthly cadence or refresh rate. What happened due to the pandemic was, when you get asked by a minister or a public health responder what happened yesterday, you can't turn around and say, well, we've got another 3 months before we get our next cut of data. It's just not practical, and it wouldn't have been useful. So what the technical group, the governance, the legal, the business, the admin group had to come all together and say, how can we really redesign, re-engineer our processes from the ground up to respond to the pandemic? So what that meant was, we have a lot of our data flows now coming in daily or weekly or monthly. And obviously, because we set them up and established them during the pandemic, we've continued those now. So they are available to all researchers, regardless of whether it's COVID or not, to apply for and access. So that's been one of the largest transformations in recent years, as well as all the new data that's been acquired. So obviously SAIL has always gone out there and acquired new data, but we have to go out and acquire a lot more data a lot quickly. So especially around some of the COVID-19 aspects like vaccination and testing and those kind of things, but also around some wider workforce related data and outcomes related data. And we continue to drive acquisition around a large multidisciplinary, multimodal style of data. So if you're interested, once again, come back and have a look at some of those links I shared earlier. And this just is a screenshot of one of the resources I mentioned earlier, which is the Health Data Gateway. So if you come on there, you can search for individual assets, or if you search for the word SAIL or the organization or the publisher, I think it's called, on the website, you can find the SAIL Databank and all the different data sources that are available. As I mentioned, the trusted research environment is accessible worldwide, and people have been using SAIL for years from across the UK and elsewhere. I guess this is just a snapshot of about a year into the pandemic, where these were just people working with us collaboratively on our single COVID-19 analysis. So you can see here just from the map of the UK, this was truly a UK-wide effort in terms of where everybody was based operationally. And there was over 200 users answering 200 different questions. We're also part of EU initiatives like FireEye and others that are also working with colleagues across the EU. So yeah, it really does show that you can do this work collaboratively, and this is the power of trusted research environments. Another sort of secondary outcome of the pandemic, which lots of projects have been doing in SAIL and lots of users in SAIL have been doing for a long time, is what is called reproducible research. So rather than every project that comes in having to restart and relearn and do everything from scratch, we really pushed the agenda when it came to reproducible research. But this has had secondary benefits now for wider users and groups in SAIL. So whether this is through reproducible algorithms or methods or code, there's a variety of different, some people call them concepts or phenotypes or code lists. So these are now getting shared more openly and widely, which is great, but also in terms of the methods as well. So really encouraging people within SAIL to share things on GitLab, or once you've requested your code or your methods out of SAIL and or you publish them, making that code, making those methods available on GitHub in the public domain so others can get used to them. And we've also pushed the boundaries in SAIL now when it comes to things like research-ready data assets or RRDAs, because we have what's called a derived data policy. So if you develop something really useful and interesting and you think others would have value, not only to the method, but just to the asset as itself, you can essentially provide that code and methodology to SAIL. And as long as they can then take that code and reproducibly run it and maintain it, then you can then make that available as an asset that you would search for on those resources that I shared earlier in terms of the websites, but people can apply for them directly. So they don't even have to run the code themselves. They can just get access to the assets directly in their projects. So there's lots of different data in SAIL. And here's just an example of how you can use linked data then when it comes to some of the answers or the research we did during COVID. So clinically extremely vulnerable people or those who are asked to shield, it was a really important topic early on in the pandemic and continues to be now, both in terms of short, medium and long-term, not only physical, but mental health impacts for those individuals. So this was just a piece of work we were asked to do about 3 months after the shielding list was set up. So in Wales, we had about 130,000 individuals who were asked to shield. We looked for the 30 days prior to them being asked to shield, what services were they interacting with, just to go through them here. So were they having blood tests? Were they seeing their GPs? Were they attending emergency department or having hospital admissions or being in critical care? Were they receiving ambulatory care? So we looked prior to the shielding initiative, and then we looked, I think this was 3 months afterwards, just to look at what the impact was. And this work has spurned on to further work now doing in far more detail. But this was just a very high level initial look at those who were asked to shield and what happened pre and post the shielding letters being sent out. We mentioned about residential-based linkage. So this was work led by Professor Richard Fry and Peter Diggle's group. And this used, if you remember it, the Zoe app data, which was a prom-style data that everybody, or a lot of people rather, contributed to during the COVID-19 pandemic. And SAIL was chosen as the place in the UK that would host this data and be accessible. So the team used the Zoe data as well as a lot of other linked data in SAIL to essentially look at an area and an individual residential level, the impacts of the spread of the COVID-19 pandemic at different points in time. And this led to different evidence that went to Welsh Government policy that, along with a lot of other evidence, informed things like the fire break and other lockdowns. And really, we've got a lot of linked data, but we need to understand the data we have already, as well as going out and acquiring more data. So whilst the COVID-19 shone a light on inequalities, I think we can all agree that there was inequalities available in society before the pandemic, and there continue to be inequalities and inequity afterwards. So one of the things that we were asked to look at is around ethnicity and what data we had and how we could maybe use it more consistently. So we looked in SAIL, and at that point in time, we had just over 26 different data sources that contained some kind of ethnicity information. And what we did then was we worked with colleagues around the UK to see how we could basically turn this into an ethnicity spine or a research-ready data asset with reproducible methodologies. So what this turned into then was that reproducible method, where if you take electronic health record data alone, you miss about 26% of the population. If you just use the 2011 ONS census, which at that time and probably even now with the 2021 was considered the gold standard, you miss about 35% of the population, which is expected due to migration and mortality and other considerations. If you use this methodology where you use the power of linked longitudinal data, you get it down to less than 5% missing. So it really shows that power of longitudinal linked data. It opened up a lot of other questions then, though, around how do we use these data? So do we go for a latest methodology, a mode or a modal, weighted mode composite? So we've done quite a lot of work around this, and there's a link in the slides here to a preprint we've submitted. And we've worked with colleagues around the UK through lots of other consortia now to try and understand how we can better use these types of longitudinal linked data, not only in SAIL, but more widely. And I co-chair a group with HDR UK's Alliance around diversity and data. And we're just about to actually hopefully publish our sets of recommendations now around how ethnicity data could be captured and used better across the UK. And then as an example about how that method then informed research, not only in Wales, but across the UK. So we were involved from SAIL in a UK-wide initiative around vaccination. So this was led by Professor Sir Aziz Sheikh in Scotland from Edinburgh. And we essentially used the power of SAIL and our linked data, along with colleagues across the other 4 nations, to look at different uptake, safety and effectiveness of the vaccinations across the UK. And we did this by leaving all the data where it was in each platform. We did this through harmonized protocols and methodologies without any data being joined together across the UK outside of their individual platforms. And then we performed pooled or meta-analyses with the results once they were approved out of each environment. And just to show you a few examples of some of the work that led to and how the ethnicity spine was then used. And this just shows really the power of using those reproducible methods to inform lots of different types of studies and lots of different opportunities when it comes to using linked data. And then you might have seen this. What this led to then was work under another vaccination UK initiative called Coalesce, which was led by Professor Aziz Sheikh and Professor Kadri Sudlow from HDR UK. This led to probably the first truly UK-wide analyses across all 4 nations around the 67 million mark. So truly UK-wide linked data opportunities there. So this just shows you a little bit of a whistle-stop tour around the power of trusted research environments, longitudinal linked data, and then what you can do with that essentially to answer a variety of different questions from different data sources and different systems. So I said that was a very quick whistle-stop tour. I'm more than happy to take questions now, or if you want to contact me later, my contact details are on the slide. So thank you, everyone.